Chapter 12, Part 2. Pack assembly. Before items can be assembled into trays, sets, or packs for sterilization, they must be inspected and, in some cases, tested to ensure that they are clean, correct, and functional. Inspection guidelines. Each instrument should be carefully inspected upon assembly and packaging. Chapters 10 and 11 address inspection techniques for several common instruments. What follows are some basic guidelines for instrument inspection during pack and prep. Note: be sure to consult the manufacturer's instructions for use for inspection requirements for specific instruments. Inspect for cleanliness. Even though instruments have been cleaned, there may still be instances where some soil was not removed. See Figure 12.6 for an example. Organic materials such as blood or other contaminants will interfere with sterilization and optimal functioning. Inspecting instruments for cleanliness adds a safeguard to the process by reducing the chance that a soiled instrument is delivered to a user area. If a soiled instrument is detected during the inspection process, it should be sent back to the decontamination area for prompt cleaning. The tray that the soiled instrument was in should be sent back to the decontamination area, as other instruments may have also been contaminated through contact with the unclean instrument. Note: do not attempt to clean the instrument in the assembly area. Doing so may contaminate the immediate area and may cross-contaminate others in the department, or other areas in the department. Inspect for damage. Instruments may become damaged through the use, misuse, transport, and processing. Look for cracks, breaks, bent tips, misalignment, and other signs of damage. Inspect for signs of wear. Even with the best of care, instruments eventually begin to show signs of wear. Scissors and other sharp instruments become dull. Surfaces break down. Springs may weaken. Screws may loosen, and moving parts may begin to stick. Damaged and worn instruments should be removed and sent for repair or discarded as necessary. The continued use of broken, excessively worn instruments could put patients and or facility personnel at risk. See Figure 12.7 for an example. Check multi-part instruments. Instruments that have been disassembled for cleaning should be reassembled and tested for proper function, and then disassembled again for sterilization. See Figure 12.8. Note: small parts such as wing nuts should be placed in an approved containment device. See Figure 12.9. When placing disassembled instruments inside the tray, keep all parts close to one another so they can be readily accessible in the operating room. Testing. All instruments must be inspected before assembly. Some instruments must also be tested. For example, scissors should be tested for sharpness. See Figure 12.10. And the installation of electrosurgical instruments must be tested between uses. See Figure 12.11. Demagnetizers. Occasionally, instruments may become magnetized. This is a source of frustration for the surgeons, especially with needle holders, as magnetization may make working with suture needles very difficult. Demagnetizers work by reversing the magnetic field away from the instrument. See Figure 12.12, which provides examples of demagnetizers. Tools for inspection. There are many tools available to help with the instrument inspection. Magnifying lamps and computer magnifiers can enlarge areas to help detect residual soil, wear, or damage. See Figure 12.13. Photos of instruments and instrument configurations, either hard copy or computerized, can also help ensure that items are assembled correctly. Instrument scanning systems, instrument etching, and instrument tape can help CS technicians identify devices and assist with pack assembly. See Figure 12.14 as an example. Instrument holding trays, groups of instruments for a specific procedure or specialty, are contained together in trays specifically designed to protect the devices and facilitate the sterilization process. See Figure 12.15 for an example. Other instrument groups are contained in trays that can be adapted to several configurations. See 12.16. In most cases, the containers are selected when the instrument tray is put into the surgical instrument system. The following are points to consider when using instrument holding trays. Use the holding tray correctly. Read the manufacturer's instructions for use and use the tray as instructed. Failure to do so can damage instruments or cause the sterilization process to fail. For example, trays with silicone finger mats must be aligned with drainage holes to help ensure air and water removal during steam sterilization. See Figure 1217. Do not overcrowd the holding tray. Overcrowding often occurs when instruments are added to an existing tray. Over time, physicians' needs may change the insert and may be added to the trays, creating a situation where the tray is too small for the content. See Figure 1218. When this happens, there is a greater risk for instruments being damaged. In some cases, severe overcrowding may impact sterilization and drying. Don't create overweight trays. Be aware of a tray weight and density recommendations from the manufacturers or sterilizers, instruments, and packaging systems. In addition to possible issues associated with heat up and drying, excessive tray weight can present ergonomic challenges for those who must lift the trays. ANSI and AMI ST77, containment devices for reusable medical device sterilization, and ANSI and AMI ST79, comprehensive guide to steam sterilization and sterility assurance in health and facilities, recommends a maximum weight of 25 pounds for containerized trays. This includes both the weight of the instruments and the instrument container together. See Figure 1219. Protect instruments from damage. As discussed in Chapter 10 and 11, all instruments should be protected from damage when handled. Delicate and sharp instruments are a special concern. Sharp points may be protected with special holders, commercially available tip guards, silicone maps, holding brackets, post or foam sleeves. See Figure 1220 and 1221, which provide examples of methods to protect instruments. Suppliers of protected devices should be consulted to ensure that devices are permeable to the sterilant being used. For example, latex tubing should not be used to protect instruments, as it may prevent the sterilant from making direct contact with the instruments. Instruments that open, such as scissors and hemostats, should be kept in unlocked, open positions to enable the sterilant to reach all parts. Devices such as instrument stringers and racks can be purchased to keep hinged instruments open. See Figure 12.22. Always follow the manufacturer's instructions for use and specific requirements. Protect the alignment of forceps tips by placing all tips in the same direction. See Figure 12.23. Forceps tips can also be protected by using an approved containment device. The most important thing to remember with all pack and prep situations is that all items must be functional, accurate, and neat or organized. Because the next time the pack is accessed, it will be used for the patient. Assembly procedures. Pack contents and pack configurations are unique. CS technicians must apply basic principles to pack assembly to create packs that can be successfully sterilized and meet the user's needs. The following section provides an overview of general assembly guidelines. Procedure trays. Procedure trays are used in a patient care setting such as nursing units and procedure areas such as the radiology and emergency departments. Procedure trays are often designed to include all of the items needed for minor procedure. It is also to disassemble multi-part items and place all items in the trays in a manner that prevents air entrapment and pooling of condensate during the sterilization process. In the past, the inclusion of disposable single-use items such as needles, scalpel blades, and sutures in trays was common. However, today this practice is uncommon. Instructions for use, including re-sterilizing instructions, must be on file and carefully followed. If the manufacturer's instructions for re-sterilization of a single-use item cannot be obtained, the item should not be included inside an in-house sterilization procedure tray. If approved, single-use items are sterilization in the healthcare facility. They must not be re-sterilized if they are returned unused. Gauze, sponges, and surgical huck towels were also commonly used in procedure trays in the past. However, many studies now show that the lint from these items can be transferred to the patient wound, even in minor procedures, causing complications such as blood clots and infection. Prepackaged sterile towels purchased from an outside vendor or processed in-house should not be opened and used on trays because they may superheat within the sterilization cycle. If superheating occurs, the tray they are in and other trays within the load will potentially be unsterile. Towels should be laundered after sterilization and rehydrate the fibers prior to sterilization. Prepackaged sterile towels from an outside vendor should not be laundered unless the IFU have been obtained from the towel manufacturer, because these towels are usually made of lower quality material to allow for single use and no relaundering. Definition: superheating. Superheating steam occurs when dry steam becomes too hot compared to saturated steam. Dry steam rises to a temperature higher than the boiling point of saturated steam. This commonly occurs when dehydrated linen is processed in a steam sterilizer. Due to the lack of moisture, dry steam is not an effective sterilant and will often char or burn items in the sterilizer. Basin sets. Basin sets should be assembled in a way that allow moisture to drain from them during sterilization. Moisture is a concern when preparing basins for sterilization because when steam contacts metal, it is immediately cooled when the heat from the steam transfers to the metal. As this occurs, the steam condenses and forms water droplets on the metal. When multiple basins are sterilized together, wicking materials such as a surgical towel, see figure 12.24, or specifically designed wicking materials can be used to facilitate drying. If basin sets are too dense, the excess amount of metal may cause condensation, thereby creating a wet pack. To avoid this problem, additional absorbent materials may be added. Very dense sets should be divided into two separate sets. All items that will collect water must be placed in the same direction to facilitate drainage. When the multiple basins are sterilized, there should be at least 1 inch size difference in basins that will be placed together to allow for condensate drainage and drying. Definition: wicking material. An approved absorbent material that allows for air removal and steam penetration and facilitates drying. End of chapter 12, part 2.